All right, Donald Tsai here. I'm an associate professor of medicine at the University of Pennsylvania. I've been here 18 years. I work with the hematologic malignancy group, meaning I treat people with blood-related cancers, leukemias, lymphomas, multiple myeloma. And one of my pet projects is post-transplant lymphoproliferative disorder, or PTLD.
We're talking about people who've had transplants of all different organ types. And what do you see as the difference from one organ to another in terms of cancer risks?
So each organ type is different, and as a result, their cancer risk is different. Lung cancer patients get a lymphoma around 6% of the time, so that means 6% of the patients that will develop a lymphoma at some point in their life. So that's pretty high. Kidneys are much less, a little over 1%, and then the hearts and livers are in between at 3 and maybe 2.5% risk during their organ transplant lifetime.
For a transplant recipient, what are the root causes of cancers that we need to be concerned about?
It's all related to almost all the risk is from the drugs being used. So for instance, the cyclosporin and the TAC, these are drugs that are also used outside of organ transplant. So let's say people with autoimmune diseases will get CellCept, steroids, and these drugs, just like a transplant patient would, and they're also prone to getting these cancers. So it's not necessarily the organ, pretty much all the risk is from the drugs. There are some issues with the organ, but it's mostly the drugs.
So whether they had transplant or not, if they had these drugs, they face the same issues?
They face the same issues,
okay.
Correct.
And some of those drugs are more, cause more cancers relative to exposure to sun, for example?
Well, so there are the contributing factors. So skin cancer carries has the highest risk after organ transplant.
Okay.
Lymphomas are number 2, though. So around 10-ish% of cancers in an organ transplant patient will actually be a lymphoma.
What kinds of symptoms should a transplant patient look for to be concerned about or go to get attention for cancers?
So the symptoms can be very vague, and so unfortunately the most classic symptoms that people often hear about are fevers, weight loss, night sweats, fatigue, malaise, just not feeling right. Other symptoms that can occur are pain. So if the tumor is pressing on something, pain can often occur. But then beyond that, it can be pretty much anything. Depends on where the tumor lands. If it lands in your lungs, you might have cough and shortness of breath. If it lands in your intestine, you might have digestive issues. It can be rather varied. Pretty much anything is possible.
In your 18 years of working in this field, if you look back 18 years ago, the big C that people were so concerned about, what would be the fatality rate, let's say back then, versus where are we today and where do you see us going?
So if you look back then and did medical literature searches, so if you look on the internet and you pull up old references and things that refer to maybe 10, 20 years ago, you'll hear numbers thrown around of up to 80% of the patients will die from PTLD. And that was a bad time back then. All they had to treat patients with was really chemotherapy and radiation therapy. But nowadays things have improved greatly in diagnosing it early. Treatments have improved to the point where I think the ratio's almost flipped around. Probably 3 out of 4, 4 out of 5 are now cured of it. So it's a much easier, safer, curable disease now than it was just 20 odd years ago.
What's it going to be like 20 years from now? What do you see for the future?
I think it's going to get even better. Just as in cancer treatment in general has improved, we've moved from a time of using chemotherapy and radiation therapy and saying that's a tumor, let's blast it, to now understanding the science behind what causes a cell to become malignant, what causes PTLD, and designing immune therapies that didn't exist 2 decades ago, targeted therapies, treatments that target these pathways inside of the cancer cell that have caused the cell to turn malignant. These things are much better tolerated and in fact I would argue much more effective for certain types of cancers.
Now I'm trying to think we had so many good conversations before. What did we miss that we're trying to capture again? Can you think of anything else that we talked about?
I don't know, my brain sort of blanked
You're
out.
doing great. Let me move this over now like I suggested to get that really high-tech background there. how do you see a patient differently, whether they're transplant or not transplant related?
So it's really important to know who you're dealing with. All right. So a transplant patient versus your neighbor who's totally healthy, you'll think about them completely differently. So for instance, if your neighbor comes by and says, I've had a cough for a week, and I'm feeling tired, and I'm having these low-grade fevers, odds are they got a cold. It's not a big deal. You tell them, drink a lot, take a couple Tylenol, see how it goes, it'll probably go away. Because you know colds can sometimes last a week or two or even 3 weeks before someone's completely back on their feet. And so that would be the response there. On the other hand, a transplant patient's a very different person. You usually have a long-term relationship with them, so you know them well. So if someone you know who never complains about anything comes and says, I got a cough, I don't feel well, something's wrong, ding, it brings up a whole slew of different things and brings up a different reaction from a transplant doctor. Just because it's the person you know and they have a different set of risk factors. So that same person may have a pneumonia, that same person may have a cancer in their lungs, totally different response, or at least there should be a totally different response.
And so if they get the advice of treating it like a typical cold, and if it doesn't improve, come back to it, as you mentioned before we didn't record it, would you repeat that part of it?
So it's okay if that same person comes in and your doctor says, well, it's probably a cold, but odds are it probably is a cold. But unlike your neighbor who says, yeah, go away, this person, there should be some sort of backup plan. All right, saying it's probably cold, take some Tylenol, drink a lot of fluids, but you know, if it gets worse or doesn't get better, you need to call me and we will do X, whatever X might be. So in other words, someone needs to stay on top of it, and if someone thinks that there really is a problem, don't wait, act upon it now.
And so go back to what we were talking about before in terms of following your instinct or following your heart when you think something's different.
So this is transplant or organ transplant is a long-term relationship between a doctor or a team and a patient. And over a bunch of years, they generally get to know each other pretty well. But this is a backwards and forwards relationship. So, patients know themselves. I would say essentially 95% of patients who have come to me with PTLD, they knew they had a problem, okay? It's not a shock that they were found to have this. They knew there was a problem, they just didn't know what it was. And so if you know your body and you know yourself and something's not right, namely if you say, yeah, I got a cough, my kid had a cough, I probably got a cold, that's fine. You don't need to go running to the doctor, okay? On the other hand, if it doesn't go away and you say, this isn't right, you need to trust your instinct and go to your doctor who should also trust your instinct and negotiate a plan to figure it out.
The patient that comes to you from the transplant team with that conviction there's something wrong, what do you do? I mean, you're going to interview them certainly, but what kind of testing do you do given what you said it's hard to tell what symptoms really aren't obvious? What kind of testing do you do to find the root cause?
Well, my job isn't that hard. Namely, patients are essentially seen by the transplant team, and so by the time they get to me, the transplant team's red flags are flying everywhere. So these patients, there's a real obvious problem going on. So if I'm trying to work up a lymphoma like PTLD, it's very simple, general physical exam, but CAT scans and MRIs are the real thing you want. Because these are generally enlarged lymph nodes or tumors, and in general, yes, sometimes they occur on your neck and you can feel it, but in general they're deep inside. Patients don't know they're there. They might have some vague pain, but they really don't know what's causing it. And so with the CAT scan, you'll often see an enlarged lymph node or some sort of tumor someplace, and you go, there's the problem. And then oftentimes you want to get a biopsy to prove what that problem is. Because an enlarged lymph node could be infection, it could be cancer, but even there you don't know what type of cancer usually.
And we certainly have an advantage here at Penn Medicine, given the network of specialists like yourselves who see not only cancer patients in general, but deal with a good number of post-transplant cancers and can treat and realize the differences to look for there. What other things within that contrasting population do you look for? In other words, versus the patient who's sent to you by a local doctor versus a transplant patient?
So the same person, shall we say, coming from a transplant team, they're different from a person coming, let's say, from your local doctor to see me. Once again, just like your neighbor, all right, someone coming from a local oncologist, you figure they have a cancer, that's not your neighbor anymore, but it's still not a transplant patient because of the medications that are on. Certain cancers such as skin cancer and lymphomas are at much higher risk, much, much higher, so they have to be first on your list. But infections, the drugs cause problems, and so there's infection risk. So is that spot in your lung a tumor, or is that spot in your lung some sort of odd fungal pneumonia that just looks like a tumor? So being a transplant patient, the list of things that can occur are different from a regular cancer patient, and it's different from your neighbor. So you got to sort of see who's walking in your door and what risks, what issues are you concerned about, what issues might happen.
Okay, I'm going to ask you to capture in your words, not my question. I'm going to ask you, what advice would you give a post-transplant patient relative to the risk of cancers? What I'm looking for is you to summarize real quick the idea of, pay attention, once you recognize something, take action, and that the life cycle is such that treated early, the success rate is X%. Fair enough?
Okay.
All right, so what advice would you give a patient relative to the higher risk of post-transplant cancers?
So you got to remember, after a transplant, there are certain cancers that you are now at higher risk for. Skin cancers being number 1, lymphomas being number 2, but there's in fact a host of others that are slightly elevated above background. And then there are cancers that just occur in normal people, and deep down inside, a transplant person is a normal person. So these are all things that you should be aware of, that you're at risk for. And so the question is, what do you do about it? So routine cancer screening is important in the normal population as well as the transplant population, and the screening is a little different. So the mammograms, the colonoscopies, things like that even normal people get, transplant patients should partake in all of these things. Skin cancer screening is very important since skin cancer is exceedingly common in a transplant patient. Going to see a dermatologist on a routine schedule, even if you have no issues, just for a skin check, is probably a good idea. Being aware of your body and what's going on, and keeping in touch with your transplant physician. So if there's something that you said, this is not right, so let's say a lymphoma that you can't even feel, just not feeling right, touching base with them and making sure that they stay on top of things and deal with whatever new issues crop up are important. And the most important reason for all of these things is many cancers caught early. Let's say skin cancer, you catch it early when it's a little dot, you buzz it, cauterize it, freeze it, whatnot, you're cured. Caught late, skin cancer is now major surgery or potentially metastatic disease and death. So there's a huge difference between a little dot and something now that has grown and has spread. So the treatments are different, easy versus not easy. The prognosis is different, 90% plus cure versus incurable. And so for all the things, prostate cancer, colon cancer, breast cancer, skin cancer, even lymphomas, it's critical that you catch it early, because that'll affect your treatment and your prognosis.
All right. I'm trying to think of what you can say that you could point to that page, that capture on camera, to sort of say, and here, this education is key to accomplishing what we just talked about, something of that nature. So what resource would you point people to, given all the advice you've offered?
Well, there's a lot of ways to learn about this and to educate yourself and hopefully make yourself a better medical consumer. All right, of course, there's the internet, but beware of many things on the internet. Most things don't apply to you per se, and many things are just plain inaccurate. But, going to a good, reliable source, such as Trio's website, they have a...
Naturally.
Of course. Let me pull it up.
I can edit things around. That's not a problem. Yeah, right.
Of course.
All right, that's right.
The computer should shut down this as we're pointing. Okay? Of course, going to a reliable source, impartial source, such as Trio's website, they have a web page here that's very easy to navigate that talk about the most common cancers and what to do about them. Give you some information, cancer types that can occur, issues that you have to deal with. Being an educated consumer is always a good thing, whether you're buying a car or going to your doctor.
With that, I'm going to come over here and say thank
Okay.
you very much.
Well,
for
hopefully
your
that was
time.
helpful and you can pull something out of it.
Well, we practiced the first time around.
I think the first time around was better, but oh well, at least you got something out of it, you know?
I don't understand how that could even possibly have happened, because when it's recording, it saves it on the hard drive, and I'm hoping when I get home and go look at the hard drive,
Maybe it'll
it's
actually
still
be
there.
in which case you can pull out some more things done a little slower.
Yep.
I was at